60 Minutes Rewind.
In 1971, almost half a century ago, emergency rooms started reversing opioid overdoses using a medicine called Naloxone. It's generic today, and industry insiders told us it can cost as little as a nickel a dose to produce. In April, in response to the national opioid crisis, the U.S. Surgeon General came out with an advisory calling on more Americans to carry Naloxone, elderly patients on painkillers, bartenders and librarians, mothers with addicted children, and children with addicted mothers. But making Naloxone accessible, getting it to those who need it, is complicated. Jennifer Plum, an emergency room pediatrician in Salt Lake City, says Naloxone is a miracle drug.
Understand, this stuff is really good at what it does. It has one job: can't get high on it, can't overdose on it, can't relieve pain with it. You can just save a life with it. I mean, how amazing is that?
Does it really bring people back from death?
It really does. And it is black and white. It is someone, hey, talk to me. No response to up and alert and talking to you.
Come on.
No, I'm serious. It is legitimately the most almost surreal thing, because not much in medicine, not much in life does that.
You can see it through police body cams. This woman in the back of a Salt Lake City PD squad car isn't breathing. The officer sprays Naloxone up her nose with a device called Narcan, provided to first responders at nearly half price.
Stay with me.
Watch it take effect.
There you go.
Another case, a young man found on a sidewalk completely unresponsive. Officers administer Naloxone. They only need to wait a few seconds.
You're okay. It's all right.
Out with firefighters in Salt Lake City one cold night, we learned that most of the department's emergency calls are not fire-related, but medical. Utah, conservative Utah, is among the top 10 states in the country for opioid overdose deaths, averaging a funeral a day.
We're going to give a little Naloxone just to see if you get any effect.
They're trying to save a man found lifeless in a park, cause unknown.
So it very well could have been an overdose, but nobody saw him do it.
So Blake, 2 milligrams of Narcan.
So how much time do you have?
About 6 minutes.
How can you get to someone across town in 6 minutes?
It's hard.
Mike Fox is the fire department's medical chief.
We, on average, give Naloxone about 2 times a day on calls.
A day?
A day, in Salt Lake City proper. It's one of our largest expenditures every year.
Would you say it's a strain on your budget?
As we see more and more overdoses, it does affect our budgets.
Did you have to persuade any of the other firefighters that this wasn't, in a way, encouraging more addictions?
Sure.
And we also hear that you save someone's life and the next day they're right back at it.
They are.
Yeah.
This is a disease, and it's a difficult disease to kick. So if we have to save someone's life 3 or 4 times, 5 times, it doesn't matter to me.
So people are overdosing repeatedly.
Nobody wants to overdose. It's not our job to judge. It's our job to save lives. And the medication will save lives. It's not a fix, right? It doesn't fix the opioid epidemic. It doesn't fix the addiction, right? This is merely giving someone a chance.
Still pulseless, still asystole.
In this case, they got to the man too late.
Okay. Let's terminate our resuscitation efforts at this time.
Since speed is essential, nearly all states have now made it legal for anyone to carry and administer Naloxone, like these 2 Good Samaritans injecting a stranger. By the time emergency responders show up, the woman has already come to. Dr. Plum runs a program called Utah Naloxone to hand out these emergency kits to anyone with 2 vials of Naloxone and 2 syringes. You go into the worst parts of town.
Sure, sometimes.
Into sex houses, you
Sure.
go into homeless shelters.
Yeah, absolutely.
Hey, excuse me, you want Naloxone?
Patrick Rizak, a former drug addict, is part of a network that has helped Dr. Plum hand out more than 36,000 kits for free some on the roughest streets of Salt Lake City in an area called Rio Grande.
You got money?
We have Naloxone. We have Naloxone. You guys need Naloxone? Our goal would be to have everybody have one of these. And so we just ask people if they have heard of Naloxone, if they need Naloxone. So you take the top off, okay? And you're gonna put the needle in the liquid, yep, and you pull it back, all right? And put it straight in the thigh, boom.
Right there.
Yep, right there, right in the shoulder. Through the clothes, doesn't matter.
Dr. Plum's brother, Sam, co-founded Utah Naloxone.
You got 2 doses and you got 2 syringes. Just put them right in a big muscle. No Pulp Fiction, not in the heart.
What if you come upon someone and they're on the ground?
Yeah.
And you think it's an overdose,
Yeah.
but it's really a heart attack, and you give them this.
You won't help them, but you won't hurt them. Same thing for diabetes, same thing for head injuries, same things for strokes.
How did you get interested in this? You're a pediatric doctor, you work in the ER.
Yeah, you know, unfortunately, my family went through dealing with addiction in our family. 1996, we lost my brother Andy to a heroin overdose.
In his situation, if Naloxone had been there,
Right.
would he have been saved?
I do think, at least in that one night when we lost him, if Naloxone would have been there, I do think he would have had another chance that night. And that was a big motivator.
And you give it out free.
Absolutely free, always will be.
So how do you get it?
We purchase it. We get grant money and we have...
Grant money?
Yeah, we get grant funds.
People on the street, and I'm including law enforcement, think, why do we have to expend money and extra energy when you're just doing it to yourself?
Right. You know, I have had the unfortunate experience of losing my dad to cancer and my brother to addiction. And I will tell you, these are both chronic and relapsing conditions, right? If your cancer relapses, you get everything. You get support from your community. You have teams of physicians that sit down and say, all right, we're gonna find the next step for you. But you look at my brother's addiction, a chronic relapsing condition, and when he would relapse, and I will own that I did it too, that there was this, very much this, all those tools, all that time, all that money.
And you went right back
and
to
you
it.
went right back, and you relapsed.
It's gonna go into the thigh or into the shoulder.
Dr. Plum's team also goes into private homes in the suburbs to train people, like the Keach family. Dad, Mom, Grandma, and Ashley, an addict 5 weeks clean. If she relapses now, Ashley is likelier to OD due to lower tolerance. So they want to learn how to use Naloxone at home. All except Ashley. She already knows how to use it.
I've used it twice on people and brought them back.
Now, were you high? Mm-hmm. And
Yeah,
you still could do it?
Yeah.
Ashley, when did you start and how did you start?
When I was 19, I started on Oxycontin, switched over to heroin because you couldn't get the other anymore.
The story will continue after this.
Ashley was a hardcore drug addict for 10 years. After many failed attempts to get clean, her parents told her they couldn't take it anymore, and she ended up homeless in the slums of Rio Grande. This is where Ashley was.
Yeah, Ashley was down here for a year.
And you used to see her here.
Yeah, we used to try to put her in motel rooms for the night when I could.
What shape was she in when you saw her?
Well, you saw her today. Imagine her 50 pounds lighter.
50 pounds lighter?
Yeah, with sores, and she was not in good shape.
She was barely recognizable. Her grandmother often went looking for her with food and offers of a comfortable place to sleep.
She was skin and bones. And she told me that how hard it was to be on heroin and how awful it was and to be addicted to it. For the last 10 years, especially through her rough times, we knew that it was either going to mortuary or jail.
You're always waiting for that call. It's going to be the jail or the morgue or the police.
I had a mother tell me that when it's the jail, she's relieved.
Yes,
I am.
We were so happy.
I was thrilled she went to jail. At least she's off the street and she's safe.
So you went down into the homeless areas and...
I would take her food. She went and stayed. I mean, she went and stayed with her.
You stayed? Where? Yeah. On the street?
Yeah. Last summer.
Your mother went.
I know. I asked her, hey, I want to come understand, and I hadn't seen her that much, and I just wanted to be with her, and I just wanted to try to understand the disease more. And so I said, can I come hang out with you, basically, and gave her the choice, because, you know, does she want me to see her at her worst? So she said, yeah, you can come hang out. So I went and met her and her boyfriend, and within 30 seconds, they were injecting right in front of me.
Oh, come on.
And I watched her shoot up, I don't know, countless times, at least 20, and smoke crack.
She learned how much of a grip the drugs had on her child. She saw how panicked Ashley would get without them.
It's a man drowning trying to get to a lifeboat. Like, that's the desperation that you have for thinking that I need this, I need to get this, you know, and I'll go to any cost.
Your brain is saying, get it for me, get it for me, get
I'll go
it
to
for
any,
me.
this is what you need to live. This is air, you know.
Now the whole family is working together to help Ashley stay clean and to learn how to save her with a syringe of naloxone if she should relapse. In most states now, you can pick up naloxone at your pharmacy, often without a personal prescription. A syringe and vial can cost around $15. But the FDA has approved 2 new, easier-to-use naloxone devices specifically for people with no medical training, a nasal spray and an auto-injector like an EpiPen that talks.
If you are ready to use, pull off red safety guard.
Problem is, they're way more expensive. The spray is $125. The injector, over $4,000.
Injection complete.